Good evening, everyone. I am Dr. Dhananjaya K L. I am a Senior Director and Consultant Nephrologist at Continental Hospitals, Hyderabad. Today, I will be speaking about chronic kidney disease, its recognition, the stages of chronic kidney disease, and some of the tips regarding prevention and treatment of chronic kidney disease. What is chronic kidney disease? Chronic kidney disease is any kidney disease which affects the kidney for 3 months or longer and which is associated with gradual and progressive deterioration in kidney functions. Any kidney disease which affects the kidney and remains untreated for 3 months or more can get converted into chronic kidney disease. Coming to what are the incidence and prevalence of chronic kidney disease. Chronic kidney disease is a global burden. It affects almost 11% of population worldwide. And in India, it is estimated that 15.7% of the patients are affected with one or the other stages of chronic kidney disease. This is a data by Indian CKD registry. We see around 200 patients for every million population reaching chronic kidney disease stage 5, that is the end stage of kidney disease, and becoming dialysis dependent or requiring kidney replacement therapy. So this 200 number, though it seems small number, if you look at the large population of India of 150 crore, it translates into a significant burden for the disease population. And it causes a huge economical as well as significant impact on the patient population and work production among India. So coming to what are the stages of chronic kidney disease, there is an international society known as KDIGO. KDIGO stands for Kidney Diseases Improving Global Outcomes. It is a society formed of nephrologists all over the world. It divides chronic kidney disease into 5 stages. CKD stage 1 is known as any kidney disease in which the GFR, glomerular filtration rate, is 90 or higher. CKD stage 2 is where the GFR varies between 60 to 89 ml per minute. CKD stage 3 is divided into CKD stage 3A and 3B. In 3A, the GFR is between 45 to 60 ml per minute, and in CKD stage 3B, it is between 30 to 45 ml per minute. CKD stage 4 is an advanced form of CKD where GFR varies between 15 to 30 ml per minute. CKD stage 5, also known as end-stage kidney disease, is where the GFR falls below 15 ml per minute. So these are the various stages of CKD. So CKD is usually diagnosed by clinicians based on patient's presentation, his clinical features, physical examination, and a simple set of investigation which does not cost too much to the patient. So if the clinical presentation or histological abnormality or radiological abnormality or urine abnormalities like presence of urine microalbumin or presence of pyuria or oliguria or hematuria, if they persist for 3 or more months, then we term the patient is having chronic kidney disease, and then we proceed towards the staging of CKD. So what is the need for staging of CKD? The staging of CKD helps us to categorize the patient whether he is having a mild chronic kidney disease or a moderate or a severe chronic kidney disease. It helps us to individualize the therapy of treatment, the follow-up, and other things can be optimized for the patient. So how these patients of chronic kidney disease present to us? The most common complication or the most common presentation by which these patients present to us is either swelling of the face or swelling of the legs. Swelling of the legs is also known as pedal edema. Swelling of the face is called facial puffiness. So this is the most common symptom by which the patients present to us. Other symptoms by which the patients may present to us is shortness of breath, generalized weakness, easy fatigability, feeling very low, generalized itching, that is itching all over the body, urine abnormalities such as passing frothy urine, passing frequent urine, passing urine which is cola colored, or otherwise we call it as hematuria, that is passing of blood in urine or RBCs in urine, passing of pus or pyuria in urine. So along with this, the patient may also have non-specific symptoms such as loss of appetite, easy fatigability, nausea, vomiting sensation, and other symptoms. As you notice, many of these symptoms are very non-specific in nature. They may occur in multiple other diseases also. Hence, patients usually attribute these symptoms to one of these manifestations, and usually they reach very late to us. Hence, the message by which I want to give by listing these symptoms is be aware or be alert about these symptoms. Not all non-specific symptoms are innocent or benign in nature. They also can indicate underlying serious disease, especially if those symptoms are persistent. If these symptoms are present, it is very important for one to go to the clinician and get themselves checked whether they have chronic kidney disease or whether they have any other abnormalities. So usually there are some goals by which maintaining which we can prevent chronic kidney disease. The important or the golden rules to prevent chronic kidney disease are to take less salt in the diet. It is always seen that it is useful to take less salt in the diet. Indian diet especially contains lot of salt and spices, and it is worthwhile to cut down salt. It is recommended to take up to 3 grams of salt per day and not more than that. Avoid high salty foods like pickles, papads, chips, ketchups, and other packed and processed foods. By avoiding these foods, we can cut down significant amount of salt. The second golden rule is to take lot of fluids or plenty of fluids. Again, this advice has to be taken in consultation with the clinician, because sometimes according to the kidney disease and according to the stage in which the patient is there and the complications he is experiencing, sometimes we might advise them not to take much fluids. So it varies from individual to individual. In general, the rule for prevention is to take plenty of oral fluids, at least 2 to 3 liters of water every day, or around 10 to 12 glasses of water. Do not take this amount of water at once. It should be distributed evenly throughout the course of the day. Third important thing is to do good daily physical activity. It is important to maintain an active lifestyle, not to be very sedentary. Involve ourselves in some of the activities, like either in playing any sports like badminton or something, or running, jogging, jumping, cycling, swimming, or any of these physical activities. By keeping ourselves physically fit, we can prevent many of these uh, onset of these diseases. Fourth important thing is regular checkup if you have hypertension, as hypertension is one of the important contributors for chronic kidney disease, get yourself checked to see whether your hypertension is under control. Do not keep taking the same medication over a lot of years thinking that my blood pressure is under control. Instead, go and check your blood pressure and see to it that it is under control. Diabetes is one of the most important and the most common cause of chronic kidney disease that we usually come across. If we go for rounds in our dialysis unit, more than 50% of our patients who are on dialysis are usually diabetic patients. Diabetics are at an increased risk of chronic kidney disease. It is very important that patients with diabetes have to keep their blood sugars under control. Do every monthly blood sugar controls and see to it that their sugars are under control. Take their sugar medications and insulin on time to prevent too much of fluctuations in the blood sugar. Do not pop over-the-counter pills or painkillers, are also known as non-steroidal anti-inflammatory drugs. Do not take unnecessary herbal medications, supplements, Ayurvedic medications, and other medications for which there is no proper prescription. Follow a healthy diet. Take a diet which is rich in fruits and vegetables. By following all these golden rules, we can keep our kidneys safe and healthy. Thank you.